In gastric cancer, there are 5 stages: stage 0, 1, 2, 3, and 4. In stage 0, abnormal cells are found in the inside lining of the mucosa of the stomach wall. These abnormal cells may become cancer and spread into nearby normal tissue. In stage 1, cancer is formed on the inside lining of the mucosa, the stomach wall. Stage 1 is divided into stage 1A and stage 1B, depending on where the cancer has spread. In stage 2, cancer is divided into stage 2A and 2B. In stage 2A, cancer has spread to the submucosa of the stomach wall, or has spread to the muscle layer of the stomach wall, and is found in 1 or 2 lymph nodes near the tumor, or may have spread to the submucosa of the stomach wall and is found in 3 to 6 lymph nodes near the tumor. In stage 2B, cancer has spread to the serosa of the stomach wall or has spread to the subserosa of the stomach wall and is found in 1 or 2 lymph nodes near the tumor. Or has spread to the muscle layer of the stomach wall and is found in 3 to 6 lymph nodes near the tumor. Or may have spread to the submucosa of the stomach wall and is found in 7 or more lymph nodes near the tumor. In stage 3, gastric cancer is divided into stage 3A, B, and stage 3C, depending on where the cancer has spread. In stage 4, cancer has spread to distant parts of the body. Some causes of gastric cancer may be having infection of the stomach by bacteria called Helicobacter pylori. If you had a polyp larger than 2 centimeters in your stomach, have inflammation and swelling of the stomach for a long time, having pernicious anemia, or if you smoke. A treatment for this cancer is surgery to remove the stomach, and is the only treatment that can cure it. Radiation therapy and chemotherapy may help. Chemotherapy and radiation therapy after surgery may improve the chance of a cure. For patients who cannot have surgery, chemotherapy or radiation can improve symptoms and may prolong survival, but will likely not cure the cancer. For some patients, a surgical bypass procedure may relieve symptoms. Some symptoms may be abdominal fullness or pain, which may occur after a small meal, dark stools, difficulty swallowing, which becomes worse over time, excessive belching, general decline in health, loss of appetite, nausea, vomiting blood, weakness or fatigue, and weight loss. Men of Asian and African descent of advanced age are most affected by this cancer. The wall of the stomach is made up of 3 layers of tissue: the mucosal or innermost layer, the muscularis or middle layer, and the serosal or outermost layer. Gastric cancer begins in the cells lining the mucosal layer and spreads throughout the outer layers as it grows. The number of new cases of stomach cancer was 7.5% of 100,000 men and women per year. The number of deaths was 3.5% of 100,000 men and women per year. 0.9% of men and women will be diagnosed with stomach cancer at some point during their lifetime. There are an estimated 72,269 people currently living with stomach cancer in the United States. No Stomach for Cancer is actively involved in raising awareness and providing information to the public about gastric cancer. There is also an awareness month for this cancer, which is November.
When I was early teenager, my cousin from my mother's side had developed leukemia. His effects were hard for him and his family mainly. He had to go through radiation, which is a chemotherapy trial where he lost all of his hair and he became weak and he didn't have an appetite. But those that were affected mostly were his immediate family. They were affected in many ways, not only through the heartache of having a family member dying, but knowing he was going to pass. He was diagnosed with the leukemia at the age of 16 and died at 21. So through those years, he had suffered extensive painful trials. I mean, the chemotherapy was painful for one. I mean, this is all coming from my cousin, his brother, which was closer to my age, so he shared his emotions, and it was really sad to hear what they had to go through. I couldn't even imagine having to go through that with my immediate family. It was hard enough to hear the pain that they had to go through during his last 5 years.
As our action plan, we can continue doing things like spreading the word about this cancer. And we can continue to celebrate things like Gastric Awareness Month to show that we care.